Hello everyone, I'm Dr. Farhan, one of the rheumatology consultant. Today I'm going to discuss a very interesting case of systemic lupus erythematosus. He is a 34-year-old gentleman who was diagnosed with SLE a few years ago. His initial presentation was very atypical, as he presented to us with the swelling of his left big toe, which progressed to involve the dorsum of the left foot. And at that time, his serum urate levels were found raised. So we thought initially that it is slightly gout. And he was discharged on tablets naproxen and some colchicine. But after a few days, he represented, and on testing the immune profile, we found that he was anti-SM, anti-UNRNP, and anti-RNP70 antibodies positive, though his dsDNA and complement levels were within the normal range, and her urine dip was tested positive with 4+ of protein. And on that basis, we discussed with our nephrology colleagues, and he went on to have a renal biopsy, which later confirmed class 5 lupus nephritis, and he was then managed with immunosuppressive agents in the form of mycophenolate and prednisolone, which was slowly tapered off. And mycophenolate was used both as an induction and a maintenance agent. Currently, he is under dual or a combined care with renal and rheumatology teams. He never showed any features of any typical features of SLE or any other connective tissue disorder. Therefore, this case is interesting for all those who are interested in learning diagnosis and management of connective tissue disorders. That CTD cases can be challenging to diagnose, and they can present, at times they can present with very atypical features. Like in his case, only symptom he has was the inflammatory arthropathy affecting the left foot. Initially started from the left toe, progressed to involve the left dorsum and the left ankle. Today we will review him again in the clinic, as he is experiencing similar swelling of his left foot, and we are worried that he is not experiencing a flare-up of his underlying connective tissue disease based on his original symptoms, who are similar to what he's describing now to us. So let's wait for him, and we'll record the live consultation afterwards. Thank you. Hi, so we are here with our patient, and we are recording this video with his consent. So just tell me, like, what are the symptoms that you are experiencing now compared to what you were experiencing when you were initially diagnosed with this condition?
Towards my left foot, my big toe, it's very hurtful.
So left foot's big toe.
Yeah.
And
There's one big toe, the joints, one big toe. It makes it difficult to put in some weight.
okay.
My,
Is this the only symptom you experience?
this is the only issue I have.
You never experienced any ulcers in your mouth, any excessive hair loss, any fingers changing color to the cold?
If I stay out in the cold too long, then my fingers, do become, really cold, and you can, the color will change.
Okay. But you have not noticed any ulcers on the fingertips? No.
If I go out and I put on a pair of gloves and I keep warm, it's fine. If I stay out for too long without proper clothing, then I can tell it gets a bit.
No skin tightening on the fingertips, no problem with opening the mouth? Eating, no reflux or heartburn like symptoms or anything. Okay. What's happening with the medications? Are you taking the regular medications that you're on?
Yeah, taking them.
Mycophenolate?
Yeah.
How many tablets are you taking?
I'm taking, it's 1,000.
So 1 gram in the morning and 1 in the evening. And you're also on hydroxychloroquine?
Yeah. 200.
And are you taking any steroids?
Yeah, prednisone.
How much prednisone are you on?
It's now dropped to 1.
1 milligram.
It was 5 for a while and then gradually,
You reduce it.
the dosage, yeah.
Any other medications that you have tried in the past for your lupus or for your...
I mean, I'm on the ones you mentioned and on Losartan.
Okay, Losartan?
Yeah.
That's your blood pressure medication.
Yeah. And Atorvastatin. Yeah. Something. It's for
That's fine. Okay, but you have not.
What's the medication like for? It's almost like
What, your vitamin D
Yes.
and calcium?
Yes. Vitamin D and calcium. Yes. First put something, and then a couple.
Lazarus.
But you've not tried any other immunosuppressive medication other than mycophenolate?
No.
Since the diagnosis. How long have you been diagnosed with systemic lupus?
Maybe 2 years or more.
2 years.
Yeah.
Have you tried any medications for your gout, or like naproxen or colchicine in the past?
I had colchicine before. Yeah.
Did it work?
No.
It never worked.
Again, this just happens periodically, right? So the last time it happened was during a barbecue in the garden on the 23rd of last month.
Okay.
I thought maybe it's just sure I was wearing at the time.
And the episode lasted how long?
It's still ongoing.
So it never goes in like never calm down. The inflammation or the pain and the swelling is still there.
Still there.
Okay.
It's better, but at times, it's unbearable.
I see. Okay. Is it okay if we can? And just reminding you don't have any family history of lupus or any other autoimmune conditions. You don't drink too much alcohol. Like how much are you drinking at the moment?
I'm not drinking at the moment, just for this week.
But in on a routine, on an average, how much alcohol do you
On
drink?
a routine, I might have, it depends, but I don't drink excessive.
No more than 10 pints per week.
No.
Because that's something related with underlying. It can trigger your gout. Not lupus, but it can trigger your gout. Okay. And you working, studying, or what's your background?
Yeah, working.
Okay.
I spent a lot of time in the office.
And is this affecting your daily routine?
Definitely.
Daily activities?
100%, yeah, massively, because I couldn't drop my daughter and my son off to nursery this morning. Yeah, just because.
And you called our rheumatology department, or our department called you?
No, I called.
You called it, okay. We will examine you, sir. Okay, if you can go and joints. And also, I will also try to look at your skin if you can expose this, fold this trouser up, both sides. And then I will do a systemic examination for your heart, abdomen. First of all, this is the affected joint, isn't it?
Yes.
Left first big toe, and then this interphalangeal joint here.
So this is fine. This is okay. This is where my problem is.
Around the ball of the big toe, okay. And is it painful if I...
That's okay.
Yeah. And now?
Let me push it up this way. Yeah.
Okay.
Yeah.
And I can see slightly increase in warmth. Yeah. Any pain on squeezing this?
No.
So MTP squeeze test is negative. Any pain around the dorsum of the
No.
foot? And any pain or swelling in the ankle?
No.
Not at all. Inward and outward movements, so eversion and inversion.
Yeah.
Normal.
Yeah.
Okay. How about the other one? No pain.
Right.
Yeah, I can see that you can see the obvious swelling around the MTPJ when compared to the right side. There is no pain, no swelling, and no increased warmth, no rash. Bend your knees, straighten them. The other one as well, bend. Okay, how about the hips?
Yeah, fine.
They're fine.
Good. Yeah.
The other one as well,
Yeah.
no pain.
No.
Okay, how are the hands?
Yep, that's fine.
If I squeeze, it doesn't hurt. Like a fist, tight. Okay, open. So I cannot see any evidence of active swelling or increased warmth around any of the small joints of the hands and the wrist. But in his case, he never experienced these symptoms. His symptoms were only involving the left first MTPJ, mimicking gout. Okay, how about the elbows?
It was fine.
Shoulders?
Yeah.
Okay. Can you open your mouth for me? No ulcers around? And can you pull your lips down? Nothing there? Roll your tongue up. Okay, that's fine. That's fine. You never had any problem with the sunlight affecting your cheeks and it's not hurting. You never had any rash on your face or around your sun-exposed areas like neck or front of the chest, nothing like that. Okay. Is it okay if I can quickly listen to your chest?
Yeah, of course.
So we are auscultating to rule out any evidence of serositis like pleurisy or pericardial effusion. Look on towards the wall. And then do you raise it? Deep breath in and out. One more time. You never had any lumps and bumps in your groins or in your armpits or anything?
No.
No experience. Okay. Nothing wrong with your tummy at the moment? So abdomen is soft, not tender. No numbness, no tingling, no abnormality in terms of power or weakness in your muscles. I forgot to see there is no evidence of any digital ulcers or sclerodactyly. I can easily pinch the fold of the skin, so it's loose, soft skin. As your immune profile is positive for an antibody called UNRNP and RNP70 antibodies, they are sometimes related with mixed connective tissue disorders where you do not see features of just one autoimmune condition, but it can be an overlap. Like you can have some features of systemic sclerosis and some features of systemic lupus erythematosus. That's why I was testing you for any other features. But this is good. This is sort of reassuring that you don't have any features.
Thank you.
Are you having like excessive amount of sugary fizzy drinks or a lot of red meat in the last few days or few weeks?
I don't know, I'm laughing.
I'm just asking because this can be the trigger. We need to separate this episode from your lupus. I'm thinking that this episode is more to do with your gout rather than your lupus. So I will test your serum urate and also to confirm and probably rule out any evidence of underlying flare of the systemic lupus. I will check your antibody profile as well. We have some disease activity markers in the form of dsDNA complement levels. They sometimes tend to correlate with the disease activity. Though in your case, previously they were normal. So just to reassure myself and yourself, I will send all the immune profile again and also check serum urate. If from diet modification point of view, I would suggest you to cut down on your alcohol consumption, number one. Cut down on any sugary fizzy drinks and red meat and seafood. Continue doing gentle exercises.
And I will continue with your mycophenolate for the moment. Your urine daily from today's clinic is reassuringly normal, only single plus protein. So I don't want to change your medications too much or too drastically. All I want is that we can go up slightly on your prednisolone to see if that helps calming down your symptoms of this pain around the first victim. And then I will chase the blood results. Based on the blood results, we can then advise you whether your immunosuppressive treatment needs modification or not, but not at this stage. How does it sound to you? Do you have any other questions or concerns?
Yeah, it sounds good. I just would, I've never had it for that long.
Yeah.
It's been a long month.
It's sometimes called as or termed as a recalcitrant gout, or where you do not get intermittent or episodic attacks as we normally see in the patients with gout, but it can be like a persistent, prolonged period of inflammation in one of the joints where there is crystals or deposition of crystals. As I didn't find any other features of connective tissue disease, so I'm less convinced that it is a flare. But with your history, I need to be very careful because you never had experienced any features, and then suddenly you notice on a biopsy of your kidneys that you were having a full-blown lupus nephritis going on. So that's why I'm checking your immune profile again, and I will also send you your urine for urine PCR, which is protein tracking ratio, which will exactly tell us how much protein are you leaking. On the urine tip, however, it is just 1 plus protein, which is not significant, right?
Okay.
But urine PCR will tell us, and then on the basis of those results and the urine PCR results, we can update you about further management plan. Okay? Thank you.